This video is for entertainment and contains the opinion of Brain Doctor Speaks. Anyone watching should always consult the advice of their own primary care physician or specialist for diagnosis or treatment.
Hey y'all, this is Brain Doctor Speaks again with you. So let's first thank you for joining us. Let's take care of a couple of housekeeping things. If you like this video, please subscribe, click the like button, click the notification bell, and share the video. Thank you for your help and your cooperation, and thank you for watching. So I would like to talk more about COVID-19 and at this point, would like to talk more about COVID-19 vaccination. So we all know that in the United States, there have been several vaccines that were fast-tracked by the FDA for emergency use during this pandemic. It now has been well over a month that the Pfizer vaccine is now fully FDA approved. So I really hope that folks will think more about this and understand that all three of the vaccines, but in particular, the Pfizer vaccine has now been extensively studied over this last year and a half since the pandemic hit. And I would also like to remind folks, as we've all heard, that the vaccines are quite efficacious. And what I mean by efficacious, I just mean that they're very effective in either preventing contraction of COVID or preventing severe disease and preventing death from COVID-19. So let's just kind of talk, I guess, about vaccinations in general. So vaccinations, they can protect those in lower or few numbers again, from contracting severe disease. However, we need to think more about this pandemic and how it's a major public health issue because of how it just went rampant across the entire world, not just this country, but we need to remember that it has run rampant across the entire world. And so that makes it a public health crisis. And along with that, treatment and trying to eradicate this disease is a major public health. So it does disturb me when there are folks out there who say that, well, stop worrying about me whether I wear my mask. Stop worrying about me as to whether I social distance. Stop worrying about me as to whether I get the vaccine. Well, it's not enough to tell folks, well, if you want a mask, you mask. If you want to stay away from other folks, you quarantine. If you want to get the vaccine, you get the vaccine. Well, there've been, maybe half the population who has decided about vaccinations. I don't have the statistics right now about how many people or what percentage of people social distance in the beginning of the pandemic and what percentage of people continue to social distance. And I also don't have any statistics about who was masking earlier in the pandemic and who continues to mask currently during the pandemic. But we do have more data about who has gotten vaccinated because that's been tracked by different health entities, including our various state health departments and by the CDC. And so it's been estimated that probably half of the adult population, maybe a little more than that, has become what we call fully vaccinated against COVID-19. And so let's talk about that because some may not know what full vaccination means. So when we talk about full vaccination against COVID-19, what we're saying is, and this particularly pertains to the Pfizer and Moderna vaccines, is that one has given the appropriate. So talking more about being fully vaccinated, what I mean by that is giving one's immune system the appropriate amount of time after receiving a vaccine dose or doses for one's body, one's immune system to mount the appropriate response to the vaccine so that one has developed antibodies to fight off a disease if one were to be exposed enough to actually develop a true infection. So that's what I mean by being fully vaccinated. So with COVID-19, and particularly with the Pfizer and Moderna vaccines, the 2 doses of the vaccine, the same one, so 2 doses of Moderna or 2 doses of Pfizer vaccine are given about 4 weeks apart. And then 2 weeks after the second dose, one is considered to be fully vaccinated. So considered to have developed enough antibodies to fight off infection, or at least fight off and not develop severe infection. And so being fully vaccinated, it's estimated that and I keep speaking about Pfizer and Moderna because I think now it's pretty well established that those 2 vaccinations are overall more efficacious than the Johnson & Johnson vaccine, although Johnson & Johnson also provides a high amount of immunity compared to not having vaccination at all. And so the other really big piece to all of this, now that we actually do have effective measures, or much more effective measures than having to simply rely on social distancing and masking, is at this point vaccination. And so the other reason I want to stress this, and why we should be looking at this as a public health concern and a public health crisis rather than just looking at one's individual self, is that the more people who are vaccinated, the sooner more people are vaccinated, the less and less hosts we have who can contract severe disease and then transmit the disease. So what I'm trying to say is, we for years have had vaccinations against other diseases, right? So we have vaccinations against chickenpox. We have vaccinations against diseases like polio, measles, mumps, rubella, certain types of hepatitis like hepatitis A and hepatitis B. And so for those that are more communicable, like polio, chickenpox, measles, those diseases have, even if not eradicated, we hardly hear about any cases of those conditions because such a large majority of the population has been immunized against those diseases. And the reason why vaccines were developed against those diseases in the first place is because those diseases are highly communicable and also have the potential to cause devastating disease or death. And so I would like to talk about that. There's, even before this COVID-19 pandemic, there have been campaigns in certain groups who have spoken out against childhood vaccinations, in fact. And so, primarily, conditions are called childhood diseases, are the ones like polio, measles, mumps, rubella, chickenpox. And I guess that's reason is not because adults can't contract those conditions, of course, those diseases, but because there's been a large campaign to have the great majority of people vaccinated against those diseases early on in life. And so I really want folks to really put that in perspective and understand that this is why we hardly see those diseases anymore. The one disease that I really like to talk about is smallpox, because smallpox has been completely eradicated, meaning that there are no known cases of that disease in the world. And so that, ultimately that's what we would like to see with COVID-19. But, in the age of smallpox, they literally vaccinated everyone against those diseases, or that disease, I'm sorry. And it's to the point where those of us who are alive today, of any generation, don't know anyone who had smallpox, and certainly we don't know anyone for decades who has had smallpox, because the disease essentially doesn't exist anymore. And so that's in large part, if not solely, because of vaccination against that disease across the board. And I can't even really tell you all the symptoms of smallpox, quite honestly, because I know how, even though that's a disease we had to learn about in medical school, one of the main things we learned is that it's been completely eradicated. And so I think that that's an important part for health professionals to understand and understanding epidemiology and public health and infectious disease. But I think it's also important in trying to better educate the general population and having some knowledge about smallpox. So I would urge you to just take a few minutes and read some about the disease and the symptoms, and it became eradicated, and that may give some further credence as to why the majority, I think, of us high-level health professionals are encouraging people to get vaccinated. All right, so let's talk about safety of COVID-19 vaccination. So that is a big reason why many people who have been hesitant to get vaccinated give as a reason why they have not gotten vaccinated up until this point. And so I would like to say, again, I think we need to keep things in perspective. So the pandemic now has been going on for about a year and a half. And now millions of people have been vaccinated against this disease. And so before the FDA even approved the fast track approval for emergency use of these vaccines, they had to test the vaccine on thousands of people before even releasing it. And then you also have those of us like me who were one of the first million people in the first week to receive their first dose of COVID vaccine. And so we now have millions of people over a year and a half to really see over a long period of time, not only how efficacious the vaccine is, but also how safe it is. Now, there's, again, I cannot give, as the disclaimer that I released at the very beginning of this video, I cannot give specific individual medical treatment and recommendations to someone whom I have not personally evaluated. However, it is my professional medical opinion that there's a very, very, very minute percentage of people who should not get vaccination of any type. Including COVID-19 vaccine. And there is a risk to everything, but by far and large, there's much more risk at this point to contracting COVID-19 than there is to exposing or setting oneself up or taking the chance of any potential adverse effects from vaccination. The folks with long-term adverse effects from the vaccinations is very, very low. I think, one doctor posted on social media, I like the way he said it, is that he's seen many people who've gotten hospitalized with serious disease from COVID-19 itself, but he's had no one be admitted for severe symptoms from COVID-19 vaccination. So I really think that more or less a simple way of putting things and discussing how safe the vaccine is. And again, I just really think it's important for the great majority of our population to get vaccinated against this potentially devastating virus so that we can get this disease eradicated or nearly eradicated, because it will stop being spread from host to host, meaning human to human, when there are less and less people who can either contract the disease or contract severe disease. And I think at this point, at least 90% of the people who are being admitted to the hospitals for COVID-19 and certainly being admitted to the intensive care units are people who did not get vaccinated in time. And I'm saying get vaccinated in time for them to have not been exposed enough to have contracted illness. Because the reality is, the longer that we see such a large percentage of people unvaccinated, the much higher risk that everyone at some point is going to be exposed to this virus. I don't care how much you try to quarantine. You can't quarantine yourself 100% from every other living human being for time on end. And so we all will be exposed at some point unless we really crack down and be more responsible about it. So I thank you for watching and for listening and for considering. And so I would like to remind you, if you like this video, please subscribe, click the like button, click the notification bell and share the video. Thank you very much. And I'm Brain Doctor Speaks.
Brain Doctor Speaks. Brain Doctor Speaks.